What do you think about the attitude that people didn't know what they were voting on?
Well, the people do know what they're voting on. People in Oklahoma are a lot more educated than the legislators give them credit for. People read the bill, they liked it, and they voted on it 57%, over 57%. At the same time, we were also running State Question 796 and 797. They know what bills are signing when they sign those bills.
No smokeable. How do you feel about that?
Well, that's just ridiculous. No smokable, because you can smoke it and you can vape it. There's so many different ways to take cannabis. When you vape it, it's a cooler temperature and it's easier. Some people can't smoke. Some people don't like to smoke, but they can vape and take it, and it's a lot easier to take.
But the argument inside there was that smokables also created a number of toxins that people should not be inhaling.
Let's do some research on it. What kind of toxins does it produce? Nothing like cigarettes, which are totally legal.
Yeah, well, I think the conversation needs to be had that, you know, if there are some medical or some health risks involved with smoking it, that needs to be something that's addressed and made publicly aware. And people need to be free to make their own choice of how they consume their medicine. And at least in this aspect, you can take the same flower, the same leaf, and you can smoke it, or you can vaporize it, but you purchase it in the same form. And vaporizing has almost no health risks whatsoever, and people need to be free to go in and purchase the flower and use it in a vaporizer, or, you know, in my opinion and in the opinion of the voters of Oklahoma, they need to be free to go in and purchase whatever they want. That's why we passed this bill.
And one thing that just wasn't right to us was holding a closed door meeting. All of our meetings have been perfectly open door. Everybody come on in, let's talk.
What about limiting the number of dispensaries? Does that encourage a black market?
Well, yes, that's going to encourage a black market, because when I was a pain management person, I would be sitting up in the waiting room and people would come up and they'd been driving for 2 hours to get to a pain management doctor because there wasn't one in our town, or they couldn't get to one that's closer. So 2 hours to come to it, and you've got to be ready for a urine test every time you get there and stuff. So yes, limiting dispensaries, no, that's just not right.
I think the voters in Oklahoma didn't have a good idea of the way it was going to be implemented. I think that nobody had any idea that we were going to limit the THC levels. Nobody had an idea that there were going to be such heavy restrictions on this bill. You know, I'm sure that there's a little bit of legal ground to cover as far as what you can regulate in a state question, because the language can't be changed. Am I wrong?
In a state question, well, it's going to be regulated, you know, it's the legislators and stuff like that. They can change it, you know, we knew they could change it. But this just over-regulation that they're running with, that's just something we can't, you know, people don't like.
Is this insulting for the people voting?
It is insulting to the patients. I mean, patients are suffering out there. The patients I talk to every day that need this medicine, they want off opiates. They want off all the whole salad of drugs that they're on. They want to be able to grow a nice, pure, clean medicine and get the relief that they want.